The following points will be covered in this video. Three main types of balances include the electronic balance, torsion balance with the dialer, and torsion balance with the rider. 4 qualification tests to make sure the balance is working properly include the sensitivity requirement test, arm ratio test, shift test, and the rider and graduated beam test. Maintenance of the torsion balance. There are 3 main types of balances that pharmacists use, including electronic balances and torsion balances with either a dial or a rider. In order to help familiarize you with these type of balances, we will be providing you with an overview of each type. However, as it is required by the law for each pharmacy to own a torsion balance, we will be focusing more on this specific type. Electronic balances are digitalized single-pan balances that are either top-loading or encased in a housing, for example, glass or plexiglass, which protects the balance from drafts and debris. This particular one is top-loading. Electronic balances eliminate the need for external balancing weights and are capable of automatically tearing containers such as weigh boats, papers, and beakers. These balances are more sensitive because they may increase the readability by a factor of 10. For example, electronic balances are able to measure 1 milligram quantities, whereas torsion balances cannot. Besides providing faster readings in comparison to torsion balances, electronic balances also have a sensitivity of less than 10 milligrams and weigh small quantities of drug more accurately. The torsion balance, otherwise known as a Class A prescription balance, is a delicate instrument used in compounding and consists of many parts including a case made of scratch-resistant metal, 2 removable clean weighing pans of equal weight and free of corrosion. Pans with appreciable corrosion or wear will need to be either refinished or replaced. A lid containing a glass top hinged onto the back of the balance that can be opened from the front, allowing for draft-free weighing and preventing dust accumulation. Leveling feet or screws to level the balance. A mechanical device or release knob to arrest the beam, preventing oscillations, permitting the operator to add or remove weight without harming the balance. An index and pointer to determine rest points. A metal ID displaying the model number, serial number, maximum weighing capacity of the balance, and type of balance. This torsion balance has a calibrated dial with the ability to measure 0.01 increments of a gram. At the end of the graduation, the dial should stop at 0. This torsion balance has a calibrated rider with the ability to measure 0.01 increments of a gram. At the end of the graduation, the rider should stop at the 0. Prescription balances operate on the principle of torsion, which is a particular method of twisting. The inside of the balance has 3 frames, each with a torsion band made of corrosion-resistant alloy around the perimeter, and 2 horizontal bars supported by the frame, which is clamped in 6 places to the torsion band. The 2 pans are attached to 2 end frames so that when weight is placed on a pan, the frame on that pan goes down while the other goes up, which causes the bars to tilt. This produces the twisting action of the bands. Another important part of the balance is the oscillation damper, which functions to prevent unnecessary swinging of the pointer, shortening the time between oscillations before coming to rest. Some balances use a magnetized apparatus to achieve the damper effect, while others use a dash pot containing silicone fluid which may spill if the balance is turned to its side. If so, the balance must then be serviced. Great care should be practiced when handling these delicate balances because they are expensive to buy and expensive to repair. There are 4 tests that can be performed in order to ensure that the torsion balance is working properly: the sensitivity requirement test, arm ratio test, shift test, and rider and graduated beam tests. Conditions for each qualification test will be discussed in further detail in a subsequent video. Here we will be providing a brief overview of the purpose of each test. The sensitivity requirement test is used to measure the minimum weight required to move the pointer on the index 1 division. The arm ratio test will determine if both arms of the balance are of equal length. The shift test tests the mechanics of the arm and lever components of the balance. The rider and graduated beam test measures the accuracy of the calibrated dowel or rider of the balance. A balance is considered acceptable only if it passes all 4 tests. If any of the tests fail, the balance cannot be used until it has been repaired and passes each test. These tests should be conducted monthly and even more frequently if the balance is used extensively. Pharmacists should always clean the balance after use for the next person to use. Before cleaning, make sure the pans are arrested. Open the lid and carefully remove each pan from the support rod, laying them face up on the counter next to their respective side of the balance. Likewise, remove each support rod and lay them next to their respective pan. After dealing with powders, crystals, or any other dry substances, a soft, clean camel hair brush or dry tissue may be used to remove debris from the balance. Clean the inside of the lid first, especially the bottom edge of the rim, because this is where most of the debris accumulates. Do not get any liquids or powders inside the support rod holes during cleaning. If necessary, any remaining debris following dry cleaning can be gently removed using a vacuum. Soft dampened alcohol gauze pads can also be used to clean the balance after dealing with oleaginous substances like ointments and oil. Afterwards, dry off the balance using dry tissue or pads. In the case that water-soluble materials such as dry syrup or sorbitol solution get stuck to the balance, follow the same procedure as for oleaginous substances, only using water-dampened gauze pads. Clean the support rods and pans in a similar fashion using the aforementioned cleaning procedure. Make sure both rods and pans are dry before returning them to their respective side of the balance. Close the lid and in the same fashion, clean the outside of the case. When moving the balance to an out-of-the-way place, always arrest the balance. To avoid damaging the balance during shipping, remove the pans and support rods. Close the lid and lay the balance on its back. Slightly loosen the arrest knobs by turning it all the way to the left. Move the internal shipping arrest post towards the center of the balance. Then lock the arrest knobs by turning it all the way to the right. This helps to restrain movement of the upper and lower beams. To show you this in more detail, notice how the 2 arrest posts lock into the 2 horizontal bars. Next, wrap the pans and support rods. Place them under the lid and close it. To avoid damage during transport, pack the balance in a durable cushioned carton. Let's review. There are three main types of balances: the electronic balance and torsion balance with either a dialer or a rider. Electronic balances do not require external balancing weights in comparison to the torsion balance. Electronic balances are capable of tearing or zeroing carriers. Electronic balances can measure 1 milligram quantities in comparison to the torsion balance. Electronic balances provide faster readings. Important components of the torsion balance to remember include 2 removable weighing pans, 2 adjustable leveling screws, a rest knob, dial or rider, index plate, and lid. The torsion balance operates on the principle of torsion. There are 4 types of qualification tests: the sensitivity requirement test, arm ratio test, shift test, and the rider and graduated beam test. A balance is considered acceptable only if it passes all 4 tests. Always clean and properly store the balance after use. Pans should always remain arrested during maintenance. Use a camel hair brush, dry tissue, or vacuum to remove powders, crystals, and dry substances. Use dampened alcohol gauze pads for oleaginous substances like oil and ointments. Use water-dampened gauze pads for water-soluble substances like dry syrup or sorbitol solution. Do not get any liquids or powders inside support rod holes. Before shipping, arrest the balance and lock internal shipping arrest posts. Wrap pans and support rods in tissue and store it inside the lid.